Dr. Nicholas Tom Sawyer is an emergency medicine physician at the UC Davis Medical Center in Sacramento. He's with us live this hour. Doctor, thanks for taking the time to be with us. I'm sure you've seen the numbers. These daily infections are now starting to decline, which is encouraging. But how long will this last? Will this fall go on with the new, more contagious variant, the one from South Africa, now detected here in the United States?
Right. Well, thank you for having me on today, John. We are seeing a decrease in the number of coronavirus cases locally, and it is encouraging. However, the news of these new variants is highly concerning, particularly with what Dr. Fauci said. The variants and the mutations are in the spike proteins, and that's the place where the vaccines are actually directed against, is the spike proteins. And so when you get the natural evolution of these spike proteins, then it makes it so that potentially the vaccines may be less effective. However, important to know is that they are already starting to work on new vaccines that will be effective against these new variants, which is encouraging.
Yeah, I know this is all about natural selection, and that, as far as this virus goes, it's probably it was originally described as one that was quite flawed, which is why it was continuing to mutate at such a sort of a fairly fast pace, at least initially. So it's just sort of a random coincidence that these mutations started happening in the spike protein, the one area where the vaccines were actually targeted.
Well, you're going to get you're going to get mutations throughout the different types of proteins that make up the virus. And sometimes they are meaningful proteins, sometimes they're meaningful mutations, and sometimes they're actually silent mutations. So we are getting mutations throughout the virus in different parts. It just so happens that it also occurs at the spike protein as well.
Okay. So how ready are hospitals and ERs, how ready are you for another surge in case numbers, given the incredible stress which healthcare systems in the US and around the world have gone through over the last couple of months?
Yeah, we're tired. It's been nearly a year to the day since the first coronavirus infection was identified in the United States, and we're tired. Everybody's got pandemic fatigue, but we're ready. We stand ready on the front lines to take care of people as they come in every day, no matter who they are. And fortunately, because the numbers are down right now, we have capacity, and we also have the capacity to flex as needed.
Yeah, I just wonder how long, how long can this go? This sort of, it's like the frog boiling in the water. It's just incremental, the stress being put on the system.
Yeah, what can we do, right? So we are the frontline healthcare workers. We have this role and responsibility and the expertise for care for people who are in need, and we're going to do what it takes to take care of people who need our help. We are, if nothing but resilient, and it is challenging, don't get me wrong, but we will be there for people.
Yeah, I mean, it's incredible how the healthcare workers have just fought on throughout all of this. Clearly, the priority now on vaccinations is a key out of all of this. I want you to listen to Dr. Anthony Fauci on who should be vaccinated and when.
We don't want, in the beginning, that most of the people who are getting it are otherwise middle-class white people. You really want to get it to the people who are really the most vulnerable. You want to get it to everybody, but you don't want to have a situation where people who really are in need of it, because of where they are, where they live, what their economic status is, that they don't have access to the vaccine.
I just want to point out, he was at the time speaking to the New England Journal of Medicine, and it makes perfect sense. But when I heard it, my first thought was firstly mixed messaging and confusion about, everyone gets the vaccine, but no, you got to wait. And then maybe some anger and outrage from those groups to be told not so fast.
Well, I think the issue that Dr. Fauci is alluding to is that the deaths that we've seen due to the coronavirus and the morbidity, so the ill effects of this disease, is disproportionately affecting people of color. And so that being said, we have to pay attention, and we can't ignore that. And that is a very important point, is many of the essential workers who are out there who are doing the daily work to ensure that everybody has the food that they need, to ensure that everybody has access to the daily goods that are required for daily living, are at high risk. And many of those people happen to be people of color. So I think that he's just being sensitive to the fact that that community has been disproportionately affected by the coronavirus, and we should take that into consideration when determining who gets the vaccine first.
Absolutely. As I say, it makes perfect sense. I just hope that that's how most people take it. Dr. Nicholas Tom Sawyer in Sacramento, thank you so much. We appreciate it.
Thank you for having me.